So basically, we need to understand the symptoms, and you already nicely summarized the symptoms. So basically, brain tumor does not have any specific symptoms in the initial stages. They may not have. It depends on where the tumor is located. So common symptoms we see are headaches, and sometimes if it is say in the one side of the brain, then opposite side may have some weakness. And then sometimes if it is in the language area, then patient may have difficulty in speaking or understanding. And if the tumor becomes little bigger, then the other symptoms like vomiting, double vision, and sometimes seizures or fits may start. So as you can see, these symptoms can be seen in many brain problems, like including brain strokes. But of course, strokes are sudden onset, and tumor symptoms can be there for a few weeks. Or, but so when somebody comes with headache, it is not the commonest thing is tumors. So of all, let's say, more than 100 patients, if you see, we may see one case that has brain tumor. So it is that uncommon. About 70% maybe migraine or tension headaches. And similarly, when somebody comes with fits, again, if you see, let's say 100 cases of fits, maybe 5 or less than 10 will have tumors. So common things are what is called idiopathic, which is familial epilepsy, and then due to brain injury, old injury, then brain clots, infections in our country like TB, brain TB, and even tapeworm. They are much more common causes. So I think, but when somebody has headaches which are quite severe, not responding to anti-migraine medications, or other symptoms like fits or weakness of hand and such things, then we should go for a brain scan, because in today's world, getting a brain scan is not so difficult, and even the costs are not prohibitive. So rather than waiting, we should do a scan, because as Dr. Manas will tell you, that if we diagnose early, then treatment outcomes are very good, rather than if it is advanced or much larger. So I would leave to experts like Manas to take it further. Over to you, Ashish.
Yes. Thanks a lot, Dr. Sudhir. I think that was a very great insight into the possible ways brain tumors can present. And yes, today only on All India Radio, I was discussing and talking to Dr. Shirisha, one of the very blessed and a dynamic pediatric hemato-oncologist. And she says, yes, the numbers are reasonably less, though not very rare. They say around 3 to 4 patients in a lakh population. And I believe Hyderabad is kind of crossing more than 1 crore. So definitely that gives an idea that we have 100+ patients. And to a super specialist, or should I say a very specialized center, we have the big numbers coming up. And who else but Dr. Manas Panigrahi, the neurosurgeon, who would want to bring an insight into it. But before I ask him to speak few words, do we have Dr. Garima ready with the introduction slide?
Sir.
So that we can have a proper insight into one and only a very, very blessed and very much helpful and approachable neurosurgeon, Dr. Manas. Over to Dr. Garima to give an intro of our Dr. Manas, sir.
Thank you, sir. It's my pleasure to introduce Dr. Manas. Dr. Manas is an HOD in neurosurgery in KIMS. He's an ex-professor in NIMS also, and he has worked a lot in the field, and he has quite international and national papers to his credit, and also he's been awarded with lots international and national awards. Please take over the stage, sir. Thank you.
Thank you. Thank you, Dr. Garima. Ashish, let me come back to the question of the incidence of brain tumors. Can you hear me?
Yes, sir, we can.
Yeah. No, the incidence depends on what infrastructure a country has to detect. Like if you go back 30-40 years ago, brain aneurysms were supposed to be non-existent in India. Even people published that aneurysm doesn't exist in India, and it came from none other than father of neurosurgery, Professor Ramamurthy from Chennai. But then now, where in India, where every district has a CT scan, now the incidence of aneurysm is as much as in anywhere in the world.
Yes.
So similarly, when it comes to brain tumors, in US, it's almost like 20 people in every lakh of population in US, because the detection rate is very high. Whereas in India, there are only, not, as Dr. Sudhir said, not many population studies, but then there was 1 or 2 studies from Tata Institute of Bombay, and where they have told that their incidence is 5 to 10 people in 1 lakh population. So that comes to around 1 person per 1 lakh. So the incidence is not very high. So if in 1 lakh it's 1, but then once the importance is, if it's diagnosed and detected early, the treatment will be better. So as Dr. Sudhir said, if somebody has headache, don't have to get worried that one has to do a CT scan. But the headache does not respond to medicine, or if the frequency of headache increases, or the character of the headache changes, then one has to get worried and consult a neurologist or a neurosurgeon and take opinion whether he or she needs a scan or not.
Yes, continue, Manas sir. That was a very great insight to understand that, yes, because that was the same point which I had learned, that now we have a more access to the diagnostics. So we are able to diagnose more, which is bringing out the hidden things that we do have the significant numbers. And one of the important point which I would want all my viewers to know, I'm very much happy that one of the very dynamic lady from Lions, the Anita Galiji is here, and with the Varghese, brother Varghese, who is from PIN and MSI, who is working to the poor population of India, especially he works with the maid servants and as well as the transgenders. Yes, because reaching out to those kind of people is important. And the only reason is what we have found is, compared to our Western partners, statistically we have found that Westerners find to have early malignancy for that purpose, for that matter, 80% in the early stage. In Indian, we find it that 80% of time we find it only in the last stage. And this staging matters a lot, because the time you reach a patient on the last stage, you have already lost almost more than half of the battle. So arriving to the diagnosis earlier is a blessing, and that's what this awareness program is all about it. So definitely.
I have a question, sir.
Yes, Dr. Garima.
Yeah. Sir, being an audiologist, I have a question that acoustic neuromas, right? So
Yes.
how common is it in India, and how frequently you see patients for it, and what is the stage of it that it can be treated in a healthier way, like early stage?
Yeah, acoustic neuromas are usually misdiagnosed. No, means most of them they just present initially with vertigo or ringing sensation in the ears, and but then a ringing sensation in the ear in the elderly in the both ears is not worrisome. But a young patient less than 50 years having ringing sensation in 1 year is something which means most of them come to you, and then but then and those they are missed because they are taken up as something related to age and all those. So if somebody comes very young with a hearing loss or ringing sensation, they will be investigated to exclude vestibular schwannoma or acoustic schwannoma. As I explained, the incidence of brain tumors is 1 in 1 lakh, and out of that includes both the cancerous and non-cancerous tumors. So, and acoustic schwannoma is one of the non-cancerous tumor. Once treated, they have a normal life. So, and the treatment depends on how early they are diagnosed. Suppose that they are diagnosed when the tumor is less than 2.5 centimeter size, then one need not go for surgery. They can be treated without surgery by giving something called radiosurgery. Radiosurgery is a treatment where a 1 day radiation is given, high focus radiation is given to treat that, and 90-95% of the time they are controlled. They do not grow in size. But then just giving one radiation doesn't mean that one has to forget about the disease, because in spite of radiation, 5 to 10% can have failure of radiation. That is why after radiation also, every once in 2 years one needs to do scan, and if it has failed, then one has to go for surgery. And even if surgery is done, they can be cured in 95% of the time. Only 5% or 10% will have regrowth after surgery if If something is left out, if it's totally removed, they do not have regrowth. So if somebody has a diagnosis of acoustic schwannoma, they don't have to panic, because it's a benign disease and curable disease, and they should get it treated early. So anybody means anybody having a hearing loss on one side should have an investigation so that they are diagnosed early. But having told means by explaining about the different brain tumors normally they are little different from the tumors in other parts of the body. Any tumor, as Dr. Ashish was telling, the staging is important, like grade 1, grade 2, grade 3, and grade 4. Unlike other parts of the body, it starts as stage 1, goes to stage 2, then becomes stage 3, and then becomes stage 4. But in brain tumors, half of the tumors, they straight away start as 3 or 4. So they do not have something called stage 1 tumor, and then they can be detected early. The stage 1 tumor, it's only, they remain stage 1, like grade 1 for the lifetime, is only the size changes. So the way a neurosurgeon thinks is totally, a neuro-oncologist will think is a little different than a oncologist of other parts of the body. Half of our brain tumors are highly malignant or highly cancerous. They are gliomas. So they straight away start as grade 3 and 4, and their survival with treatment depends on the stage they are diagnosed. Like if they're grade 1, they have 7 to 10 years of survival. If they're grade 2, they have 5 to 7 years. If they're grade 3, it's like 2 to 3 years. And if it's grade 4, it is 1 year. But with the present newer treatment modalities, newer chemotherapy, the grade 4 people also survive for 2 years. But then if we diagnose late, then the survival still comes down to 3 to 6 months.
Okay, thank you, sir. Thank you so much for that.
That's a very excellent kind of insight into acoustic neuromas. But if I am of the right opinion, I think the what actually turns out to be the most common brain tumors in our Indian population, Manas?
Yeah, the commonest brain tumor is a glioma. Is a tumor of the brain, not the nerves. Means tumors of the brain can be from the brain as well as on the nerves. Nerves are something from the, like an acoustic schwannoma, or it can be from third nerve, fourth nerve, sixth nerve, seventh nerve, and the lower cranial nerves. But if it's from the brain parenchyma, then it's called a glioma, and then they present with headache or seizures, fits, or memory disturbances. Some of them, they can have psychiatric disturbances also, and they can have visual loss, and some of them have difficulty in speaking. And if the brain tumor involves like essential part of the brain, like the central part of the brain, which controls the movement of the hand and leg, then they can present with weakness also. They have difficulty in unbuttoning of the shirt in the hand. They cannot wear the foot, and they can have difficulty in walking. So it depends on which part of the brain is affected. And if it is the central part of the brain, then they can have unconsciousness also. And if it's a tumor of the pituitary gland, which secretes all the hormones of the body, then they can develop like for females, they can have they lose their ability to have the normal every month cycles, and then some of them lose their ability to conceive, or they cannot have a child also. And if that the pituitary gland, some of the hormones, they can have increased secretion of hormones also, then those people, they can become very tall. If like you have seen must have seen in circus, tall people. So that's called acromegaly, because of secretion of growth hormone producing tumors. And some of the means there's some hormone called milk secreting hormone, or prolactin. And then if that hormone is produced more, many of the females, they come with with a complaint of excessive milk secretion from the breast. And they actually take it as a normal phenomena. It happens with puberty, it happens with pregnancy. But then if the secretion of breast milk secretion continues after pregnancy for many years, then one has to think that probably it's a brain tumor and do a scan also. So there are many features of suspecting tumors. I mean, anything abnormal, what you think a person perceives, then one has to consult a doctor whether to get an advice whether he needs further investigation or not.
That was a very wonderful insight into the way a brain tumor can present. How often do you have a confusion between a brain tumor and other SOLs or space occupying lesion? Because how important is the neuroimaging? Because एक चीज मैं बोलना चाहूंगा, you and me have been practicing in Hyderabad. I think two statements from Telugu people have killed or whatever made the situation worse. Number one is Ausarama. आप कुछ भी चीज बोलिए investigation को, तो he will say कि sir, is it needed? And I think second statement is Nenu Anukunna, कि मैंने सोचा कि. So they doubt doctors a lot. So just I would want to ask you, how important is it that we should go aggressive on making sure that neuroimaging is done whenever there is a possibility of a brain tumor or any SOL?
Yeah, no, whenever as Dr. Sudhir also pointed out, whenever we suspect there is a change of a brain tumor, so all this time we have discussed that whenever the symptoms are not responding to medicines, or there is a change in the type of their complaint of their headache, and then one has to investigate, because earlier the diagnosis, the treatment response is better. But what misnomer is, all brain tumors are not cancerous, and brain tumors means tumor is just is literally meaning tumor means it's just a swelling. A swelling can be cancerous, can be non-cancerous. Among the non-cancerous tumors in India, one of the commonest non-cancerous tumor is a infection because of tuberculosis. It's called tuberculoma, which doesn't need surgery, and if it diagnosed which can be diagnosed with an MRI, one can give medicines for 1 year and they get cured of that. Similarly, there are other diseases like Cysticercosis, is again like an infection of the brain. What is important is, unless you investigate, do a CT scan or MRI, we cannot predict whether it is an infection or it is a cancerous tumor or a non-cancerous tumor. And because half of them, of the tumors so-called we diagnose in the brain, do not need surgery, they can be treated with medicines. Dr. Sudhir, you want to comment on this?
I think see, it's very important that we do the scanning wherever indicated. So Dr. Ashish was telling that many times patients are reluctant, and sometimes doctors also are reluctant. They feel that it's a routine case of headache. But if it is, say, the commonest cause of headache, as I mentioned, is still migraine and tension headaches. If we see 100 patients with headaches, about 70-75 will turn out to be one of these two conditions. But they respond to medications. So when we treat them for 2-3 weeks, then when we call them after a month for review, they should feel better. Or if even before that, if they come back and say, doctor, my headache was little less, but now after a week, despite taking medicines, headaches are getting worse. So we should not just brush them aside and say, okay, fine, thoda din aur leke dekho. So as a doctor also, we should guide them, because today's the cost of CT scan and MRI has drastically come down compared to the cost of other things. A CT scan would cost around 1,000, or even sometimes in the range of 2,000 in even private setups, and government setups maybe even lesser. And more than that, if somebody goes for a movie and has popcorn, they'll be spending that much. So if for that cost, if you are able to diagnose a brain tumor or anything, even if suppose we do a scan, it comes normal, it gives peace of mind to the patient as well as the doctor, and then we can treat aggressively. But more importantly, and earlier we used to say, okay, as a doctor, look at the fundus, examine the fundus. If there is papillary edema, means that shows that the brain pressure may be high, and then go for scanning. But we know several cases where it may not show in the fundus. So the clinical examination is not a foolproof method to say somebody has a tumor or not. So whenever in doubt, we should recommend and then get the scanning done. And then the second point Dr. Ashish raised is, are we always clear on a scan whether it's a tumor or not? So many times, nowadays we have good MR imaging. We can differentiate between tumor and infection in most cases. But whenever in doubt, we should refer to, Dr. Manas, and then they can do a biopsy without much invasion of the brain. They are very safe in sometimes stereotactic procedures, and he will discuss more about them. So biopsy of a lesion, when we find something which is, we are not sure whether it's infection or tumor, then again, there also biopsy can help. If we confirm, then we can give specific targeted treatment, medical treatment, or whatever else is required. So we have good, technologies today to diagnose. So MRI followed by, if required, biopsy for any space occupying lesion.
Yeah, no, what Vasis was pointing out was that when we ask a scan to a patient, patients do not accept. They think that we do it for commercial purpose. So let me explain something that in India, public think that whenever a doctor asks a question, probably he is interested in earning. That is why he is asking. But nowadays, the cost of investigation has come down so much. So I don't think any doctor can earn from getting that investigation. That is just a thought. Psychologically, people have a wrong notion. If you go to US, it means in India, people are diagnosed late because they do not investigate, thinking it's an expensive. But the same investigation, which costs 1,000 rupees, if you go to US, it costs $1,000. And insurance companies do not approve for a CT or MRI for the people. And in US also, they'll end up seeing big tumors because insurance company do not approve. So whether it's a developed or underdeveloped country, things are the same. Rather, like today I saw in OP patient, 2 patients who are there in US, and they come back, they want an investigation here because they cannot get it done there. They cannot afford their insurance company is not approving. So it is more public should be educated that what is required. And unfortunately, we have annual screening which includes heart echocardiogram, but annual screening does not include a brain scan. Whereas in Japan, annual screening includes a brain scan. If brain scan is included in our annual health screening, then many things can be diagnosed early. And if it's done in a mass scale, the cost of investigation also will drastically come down. Rasis, did it address your question?
I think that was a good point, sir. What you said, that we should actually include in the annual screening, and obviously the cost will also go down. That's a good answer. I want to ask one question. When a person is diagnosed with a tumor and he is neurologically, he's showing all kinds of aggressive behavior, and at a later age, like 85, 90, so what is the treatment option does he have at that age?
At what age means?
85 plus.
85
plus.
Yeah.
Yeah.
Yeah, that depends on means on the scan. What is your probable diagnosis? So at 85 years, there can be a malignant tumor. If you suspect that it's a high-grade tumor from the MRI, like grade 4 tumor, MRIs can predict 90-95% of the time. It cannot tell 100% that what grade it is. So if it's a 95, suppose we tell that it's a very high-grade tumor, and 85 years, again we have to see whether he has diabetes, hypertension, heart disease, then asthma and all those. So it depends, and how fit is he? Like some of them at 85 years, they do not have any additional disease, and they are fit and they are independent. Those patients should be offered treatment, like should be offered surgery, have diagnosis, and then further treatment. If it turns out to be grade 1 and 2, nothing needs to be done. If it turns out to be grade 3 and 4, then we have to give radiation and chemotherapy. But somebody who is not independent, who needs help to walk around for his daily activities, and then he has associated risk factors like heart disease and hypertension, which are that is not fit for an anesthesia for surgery. Then one have to clearly explain the family whether they want to go through the ordeal of surgery, radiation, and chemotherapy. Because in that case, even if we give surgery, radiation, we can prolong the life by 1 year if it's a high-grade tumor. But if we don't treat it, they probably will survive for 3 months or 4 months. So the decision depends. It's like it has to be customized to the particular patient rather than a general decision.
Okay, so it's a call between the doctor and the family.
It's more of a family. Okay. Because some family, they feel that surviving one more month also is very important. Even if if you don't do anything, patient will die for 1 week. Patient die in 1 week. If you operate 1 month, they will tell no, we go for surgery. So as a doctor, our job is to give the information. The decision is something family has to take.
I think that's a very right thing which you have said, Dr. Manas. I strongly believe that me being in internal medicine, I am a public health guy. I like being more into the preventive aspect. And I have realized that during this pandemic, all of us have to learn. It's all about 3 I's. Number 1 is information. Number 2 is investigation. Number 3 is insurance. So we all need to have a right kind of information which is to be disseminating in the different state of society. I would be very happy to invite any question from anybody. We have our DNB resident also who have joined for this lecture, which is a very, very important one. Now, as we are discussing it out, what are the various modalities of treatment available for so-called brain tumor? Is it only surgery, and what are the other things? That's one part. And if I have the blessed presence of Dr. Manoj Agrawal, who is a lung cancer specialist from United States, if he's around, I would want his insight into a few words about secondaries in the brain from any cancer as such. So first to Dr. Manas, and in the meanwhile, we'll check out if Dr. Manoj Agrawal sir is there. So what are the different modalities of treatment which are available other than the surgery?
Yeah. There are 3. One is to give, if anybody is diagnosed with brain tumor, one can go for surgery, confirm the diagnosis, and then give the treatment, either radiation and chemotherapy. But then all the patients are not fit for surgery. Some of the tumors are in the central part of the brain where we cannot remove it. Then we make a small hole of a 2 millimeter hole and take a small piece of tissue, do a biopsy, and then depending on what are the diagnosis, again go for chemotherapy or radiotherapy. But recently people have tried that without biopsy, can we diagnose the tumor? There is something called liquid biopsy. Liquid biopsy is something you take blood or serum of the patient and then do some studies and find out whether you can diagnose tumor. It is still in the experimental phase. It is not yet confirmed. It's not yet established that we can do a liquid biopsy, diagnose tumor just by doing blood test. Only 2 tumors of brain are diagnosed with blood test, that is germinoma and non-germinoma tumor, where we can do a serum alpha-fetoprotein or beta-HCG and diagnose that brain tumor, and then we don't have to go for any biopsy or surgery and straight away give radiation or chemotherapy. So there are 3 modalities: surgery, or directly radiation, or directly chemotherapy, depending on the diagnosis from the blood. But if in MRI we suspect that it's a non-cancer, it is totally benign, like Dr. Garima was asking about acoustic schwannoma or a small meningioma. Those cases, again, if it's less than 2.5 centimeter size, one can do radiosurgery. Radiosurgery is giving radiation for 1 to 5 days, a highly focused radiation for 1 to 5 days directly to the brain. And there are 3 forms of radiosurgery. One is called X-knife radiosurgery, one is gamma knife, and one is cyber knife. Whichever is available in the city, one can take that. There's another treatment called laser ablation, where again the laser fibers, which are 0.5 mm thickness, that can be inserted into the center of the brain, the tumor, and then they can be burnt. And it is most commonly used in metastasis, as Dr. Ashish was telling, from lung cancer. Different when there is a cancer from other parts of the body which has gone to the brain for brain metastasis. So people, because there are many in metastasis, there will be multiple tumors in the brain, and one cannot operate on both sides or make multiple holes. So you make multiple holes, place the laser fiber in the center of the tumor, and burn it. So that is called laser ablation. It's called, comes as visualized therapy. Is Dr. Manoj there to speak on metastasis?
Hi, I just joined.
Yeah.
Sorry, I'm just waking up.
Before Manoj speak, I would do my duty. One of the very blessed seniors, we had a great time from CMC Vellore, and currently he's one of the very leading, lung cancer specialist practicing in the United States for more than a decade or so. Manoj, I'm so delighted to see you and have you here. Over to you, please.
Manoj, hi Manoj, I am Sudhir here.
Hey,
Hope you recognize me.
Yeah. Okay, sorry. So what's the topic? I'm just
very simple, Manoj. How we are talking about, it's a June 8th is the Brain Tumor Day. We just want to have your input. What do you say about secondaries in the brain? How often do you kind of get to see it as a specialist in the lung cancer specialty in the United States?
So generally when I generally mention about brain tumors or spots in the brain, it's always 90% of them are secondary. So 10% of them are primary brain tumors, whether it be gliomas or GBMs, etc. But most of the time it's somewhere else, so the common being breast, lung. As an oncologist, obviously, any patient who ever talks about headaches, nausea, vomiting, or difficulty in vision, but our threshold to do a CT or an MRI of the brain is very low. We do a lot of these imaging right at the time of diagnosis, part of the staging workup, as well as in routine surveillance. Now, of course, that any spread into the brain or anywhere else also automatically makes it a stage 4. And the treatment has changed dramatically over the years. So of course, initially, we always talked about surgical metastasectomy. So our surgeons, if you saw just one spot, just cut it out. It was always followed by whole brain radiation. So whole brain radiation over the years, we have realized comes with its own toxicity. And the joke is that, hey, you're going to drop your IQ by 10 to 20 points in the next year or two. That means after whole brain radiation, generally there's a decline in the mental function of the person. So the field has moved away to more of a gamma knife or stereotactic radiation treatment, in which case, we would pinpoint the radiation just to those few spots that are seen. And these procedures can be repeated as often as needed. So it has allowed us to treat the brain metastasis with minimal toxicity. And since our patients in oncology are living longer and longer, even with stage 4 cancers, based on all the newer targeted therapies or immunotherapies, the fact that the brain mets can be adequately treated for a prolonged period of time, has been a blessing.
Okay, Bob. That was a great insight, Manoj. Really, really too excited to see you here, and thanks for that. With that note, I would move back to Dr. Manas Panigrahi. Sir, as Dr. Manoj is talking about it, what is we always, as an Indians and as Easterners, have this idea, the gamma knife and the other things. How is the availability of the various technology which is there in the Western world? Do we have almost everything available in India nowadays, or we are still there are a few possibilities we look forward to the Western world, to rather a patient to be shifted there for something better? I would say, how is the available technology with us in India, especially for that matter in Hyderabad?
Means India means we have everything what is there in other parts of the world. That's available in India, and fortunately is available in Hyderabad also for brain tumor. We also have I think proton therapy is there in India with Chennai, but proton therapy is more used for children with malignancy. It has less of side effect because of radiation. But if you look at all other technologies of treating brain tumors, one need not go to another country for treatment.
Okay, I think that was a very great thing. If there is any other question, that will be great. We will take it up. Otherwise, I will go ahead with my question. Like the information, the investigation, and then the insurance. I think the pandemic should teach us, and it's very important, because when people misunderstand when we ask the question, do you have an insurance or not? And like a lot of people understand that probably our approach to the patient will change, and rather the bill will be more. How important and how costly the neurosurgical treatment of brain tumor can be, and how much do you advise anybody should keep in mind? In the sense is like, look, am I fine to have an insurance of 10 lakhs for myself? This is just a general question. If you want to have the best treatment possible available in India from brain tumor point of view, especially for the family members, I strongly believe that when somebody has it, there are a lot of things run in the family. So if somebody in the family has got a brain tumor, my first question is, what are the possibilities of the kids and the siblings to get it? Number one. Number two is, how much of insurance on a rough basis anybody in India should consider it, keeping brain tumor in the mind? Dr. Manas as well as Dr. Sudhir to say a few words about that.
Sudhir, you'll tell?
I think I will tell the general things regarding insurance. Definitely, insurance is very useful without any doubt. So whether, patients have any negative opinions about that, they should not have, because if you look at the premiums that one pays, and, look at, let's say, if there is a remaining life of 30-40 years, even if in the next 30-40 years, if they have one major illness, the whatever premium they have paid, most of it will be recovered. So it's cost effective and economical from that point of view. And second thing is that, in India, if you look at the number of families that have gone into poverty, or, from, good financial status to poor status, major illness has played a major role. And that happened in the COVID pandemic. We saw many families going below the poverty line or going into financial crisis, because most patients in India, they need to pay from their own pockets. We have governments, central as well as state governments, doing their bit. But despite that, some treatments are not covered in the schemes that they have. And, one patient who needs ICU care or any major surgery, whether it's a neurosurgery or cardiac surgery, can, make them go into financial crisis. So insurance definitely is useful. Now I'll ask Dr. Manas to comment specifically about the brain tumor. How much cost can it be, depending on various tumors and other factors.
And before Dr. Manas takes over, one of the family members or grandfathers, anybody having malignancy, how much does a possibility for a brain tumor to run in the family?
Yeah, brain tumors are not, fortunately, they are not familiar. Very few tumors are familiar. They are benign, like von Hippel-Lindau disease and neurofibromatosis. None of the familiar malignant brain cancers are less than 0.1%. Only some of the benign tumors, as I told you, neurofibromatosis, von Hippel-Lindau disease, they are familiar, and so if a family has, then their family members should be screened regularly with MRI, because the tumor does not, it appears with age, as age increases. It may not be there in childhood, but then it can come later. So if a family having neurofibromatosis or von Hippel-Lindau disease, the children should be screened once in 2 or 3 years with an MRI to have an early detection of any brain tumor.
Okay, that's a very great insight. That yes, thankfully the brain tumor is not a familial, and we need to be okay with it. But even with this 0.1% chances, say I like to play around on the side which will be beneficial for the patient. So even with the 0.1% chances of running the family, I would want to teach my resident that yes, if taking a good history is always a meaningful, and then definitely that could be the first case which you are finding it out. And 0.1% for a population like that of India is a big, that will be again in the lakhs. It won't be in the few hundreds of thousands. It will be in lakhs. So that makes a big number. Now the next question is a health insurance. How much do you believe on an average Indian? So because you have been seeing the patients almost every day, definitely 5 to 10 brain tumors per day. So what do you suggest should be an average ticket size for anybody to consider, so that there is a message, a take-home message for all to consider that, sir?
Yeah, as such, brain, whether it's a brain cancer or cancer anywhere in the body, it is one has to have a insurance to cover the cost of treatment. And unfortunately, people think that the cost is in the surgery. It is not true. It's not, the expense is not the surgery. Surgery is a one-time cost, but the expense more comes with radiation, chemotherapy, because that's a lifelong treatment. So it's not for surgery. One may have an insurance of maybe 3 to 5 lakhs insurance, basic insurance must. But then when it goes to chemotherapy, like any other cancer in the body, and that keeps on going, the expense keeps on building up. So always have a basic insurance of 5 to 10 lakhs and have a top-up insurance of another 30 to 50 lakhs. Top-up insurance at 30 to 50 lakhs comes up with a very less premium, so that only is used if you need it, and and the insurance company approves that also. So always better to have a basic insurance of 5. Means it's a general rule for all cancers. Fortunately, in a brain high-grade cancer, they survive less, so they don't have to go for more than 1 to 2 years of chemotherapy. But if somebody has cancer in other parts of the body, they need to take chemotherapy for years together. So the cost of treatment is still higher in other cancers. So my advice will be to have a baseline insurance of 5 to 10 lakhs and a top-up insurance of at least 30 to 50 lakhs to cover in case of any, if anybody is diagnosed in a family of any cancer.
Okay. Sir, I have a question. How common is brain tumor in young kids, like, preteens?
That incidence actually is not known. As I told, it is 10 to 20 per lakh of population. So if you extrapolate that in children, it is because we get children born with brain tumors also. But that is very rare. The difference between children who is born or children who suffer from brain cancer in less than 1 year, they are bad diseases. They are very highly malignant. So they survive less. Compared to young adult who is suffering, they have a curable disease. Again, it becomes bad when it comes to 85 years. So in the extremes of age, the tumors are bad. Whereas in the middle age, the tumors are good and curable.
Okay, sir. Okay. And there's one question from the audience. What are the symptoms of brain tumor?
It depends on what part of the brain is involved. Like if it involves the nerve of the eyesight, they'll have they'll have loss of vision, cannot see properly, they cannot read properly, or they can see one half. If they're looking at the newspaper, they probably will see half of the newspaper. If it involves the nerve of hearing, then they'll have a ability they cannot hear properly. If they have the nerves of the swallowing or the nerve of the speech, like phonation, making sounds, the lower cranial nerves, then they'll have a change in the quality of speech. Somebody who was singing very well, the voice becomes very hoarse. They cannot sing properly, and they cannot swallow. They can swallow liquids, but they cannot swallow the solids also, because if the lower cranial nerves which are responsible for swallowing is affected. Similarly, it depends on the part of the brain. Suppose the front part of the brain is affected, then they have problem in concentration, they have memory problems, or thinking, ability to think also is gone. And if it's on the left side, then ability to speak, they have difficulty in speaking. And if the tumor involves the central part of the brain, like here at showing, then this part controls the hand and leg on the opposite side. So they'll have difficulty in holding a pen or writing. They can have difficulty in wearing their slippers. Then they might have difficulty in walking. And if it involves the parietal, something between like the posterior part here, they can have geographical disturbance. Means if they're left out in the market, they cannot come back home. And even if they're left in the room, they cannot probably go to the bedroom also. Tell them to go to the drawing room, they cannot go. There's something called geographical disorientation that happens when something is in the parietal lobe or this part. And if it in the back part, then again this is responsible for vision. So they cannot again see, lose vision. And if it's in the here behind, in front of the ear, this part of the is called temporal lobe is affected, then they'll have memory problem, and they cannot sometimes tell properly the words. They may tell the action. If you saw a phone, they can so tell that it's a thing, something to use to call up, but they cannot tell it's phone. So they'll have difficulty naming objects, naming person. So the symptoms depends on which part of the brain is affected.
Okay. So quite a range of symptoms depending on the area. So okay. So there's one more question, that as an initial screening investigation, if there's a suspected tumor, what is best, CT or MRI?
Yeah, if it's a screening, MRI is always better, because CT scan might miss small lesions, and sometimes it misses not only small, but sometimes a tumor which looks like a normal brain also it will be missed in the CT scan. So if you're doing a screening, then better do an MRI if the patient can afford. It's only if the patient has all the symptoms, is already symptoms, you're highly suspicious, then a CT scan with contrast is the second choice.
Yes, sir. Okay. So based on your answers, like the symptoms, it is quite overlapping with many other disorders also. Like when you said swallowing and when you said hearing, these are quite overlapping. So it's not quite easy, right? So for a layman to understand. So who's the first point of contact if for any kinds of symptoms a layman should go?
I think definitely the first person should be the general physician or the family physician.
Yeah.
And because it's not always neurological also. Many times it could be sore throat which will change the voice. So so they have to meet the general physician, and they'll be able to guide. And mostly if they can sort out, that's fine. And if they feel strongly that it's neurological, then they'll refer to a neurologist.
Yeah, there's a disease of the vocal cord. Small tumor on the vocal cord also can change the voice, and then they have to go to the ENT doctor. So the primary thing is a family physician or the MD physician. Then he will direct to the proper specialist.
So, sir, I have a question here. We were answering, so question triggered. Now directly related to tumor. When it is complaint of vertigo, so who is the first person? There's always a confusion when it is vertigo. People go to orthopedic, people go to ENT, people go to neurologist. So with the symptoms of vertigo, whom they should go actually first?
I think, see, if you look at vertigo, many times vertigo can mean various things to the patient. So when they come saying that vertigo or chakkar, we should first ask them to describe what they mean. You'll be surprised. Even many times for epileptic fits, they say chakkar aata hai, theek hai. And when you take history, they'll say ki there are tonic-clonic movements, and then they froth and they become unconscious. And then sometimes it could be just what is called as syncopal attacks, like they'll be standing in the hot sun for 1 to 2 hours, तो उसको चक्कर आ गया, तो that may be syncope. So first is to take more details about the history, and then if we are confirmed that it's what they mean is the true vertigo, where they have subjective sensation of feeling rotation, or the surroundings are evolving, and then we have to see what is the likely cause. And if you look at just the epidemiology, about half of them will be related to ear, and in the ENT mostly what we find is this, what is called Bppv, benign positional vertigo. And again, with the help of history, we can elicit that history, that when they turn their head on the bed from one side to other side, vertigo comes for 30 seconds to 1 minute and it stops. So history is enough, and with simple bedside maneuvers, we can diagnose and also treat them, rather than giving them some anti-vertigo tablets. And then if you take history along with the vertigo, if they have other additional neuro symptoms, like suppose they say that along with vertigo there is double vision, and then there is imbalance while walking, sometimes the hearing deficit, or drooping of eyelids. So additional neuro symptoms, if it is sudden onset, it could be a sign of what is called posterior circulation stroke. Then again, doing an MRI can confirm it and we can treat it. Whereas if it is something which is going on for last few weeks, then again MRI is required, because it could be a tumor or infection or other demyelinating illness. So presence of vertigo along with other neurological symptoms, it takes it to the brain. If it is just isolated vertigo as a presenting symptom of, say, CP angle tumor or brain stroke, it is not that it cannot happen. There are case reports published. So, so then, but still, if you examine them carefully, look for their tandem gait, rhombus sign, some subtle cerebellar signs. This is for the residents who are joined, because not for the public, they may not understand this. So, then that can help us, pinpoint to the neurological causes, and then, go for the scan. But I would say half to 2/3 would be ear related, and maybe 1/3 maybe neurological, and sometimes severe spondylitis also can cause, but that is a much lower on the list.
Okay, sir. Thank you for that answer. It's quite insightful. The theme of today's is like brain tumors, and we have been discussing so much about it. Thank you so much for your time. I request the audience, if they have any more questions, to bring up. How common is weight loss in brain tumors?
If it is malignancy, like, we know the symptoms of cancer, loss of appetite, loss of weight. So, and especially if it is metastatic, then definitely weight loss will be much more common in that category. Or if it is, say, tumors involving the swallowing area, so patient may have dysphagia, they may not be eating properly, leading to weight loss. So that takes it to the cancerous category, especially metastasis. In a benign brain tumor, the weight loss may not be common.
True.
Okay.
For brain tumors, weight loss is not one of the, unlike cancers in other parts of the body, where weight loss is very common. In brain cancer, it's not so much.
Yeah.
I'm
very delighted that we have a presence of Dr. Sajana, who is the integrative oncologist from area from ECIL. I would want to call upon Dr. Prasanna. She is a neurologist, eye background completely, from at St. Teresa Multi-Specialty Hospital. Rather, it's very easy. A lot of our patients kind of reach to you, Manas sir, and I feel very happy. Prasanna, are you there? So there is, to all my other friends also, I communicate. I believe my students will be here, that internal medicine are not there to treat complications. Internal medicine are actually there to prevent complications. So if we can have a preventive approach towards our patients, and we can tell them that more and more of investigations and less of hospitalization, that is the right approach. And then it's always good to give elective case to our surgeons rather than waiting for an emergency to happen. So I think this is what I would want all of us to understand. And investigations are key point to none of the doctors are magicians, or the way people say it, Miru Devudu, I wish we were, but none of the doctors are gods. They just are humans, and they can only read the investigation and help you out. So do not avoid investigations. And with what we have learned from the death of KK, that a heart attack kills suddenly but comes very slowly. That's a heart attack being number one killer, and CVA or the stroke being number 2 killer in the world. We should know that it's only right approach to a disease which comes over the years is what is the right time, and that's the only reason we all are here. I'm so very happy that Dr. Manas sir, such a very busiest neurosurgeon on the Twin States, is here with us. I thank Navaras, who has joined us, my student from Gulf. He's one of the very, very busiest clinician from Sri Lanka, currently practicing in Gulf. He's here, so thanks for joining. Any specific question, I would ask Garima to find it out. Otherwise, I think it's almost an hour, and we probably will take a call and close it once everybody finds out their own questions. Garima, over to you.
Sir, all question has been answered.
Yeah, but before, as you said, complications, to avoid complications is more important. I just want to show a picture. Ashish, can I say so? A picture of what...
Can you make sir as a host, please?
Yes, sir. Just a second. Yes, sir. Please go ahead.
Yeah. Can anybody tell how much brain one needs to survive?
That's a very good and tricky question. Is Ankit here? Anybody else wants to go for a luck?
And normally people think some brain tumor is there, half of the brain is gone. So my life is gone. I'll not survive. So
I think before Manas gives the answer, I would just share my experience. One person had, cerebellar infarct, bilateral cerebellum, and then because of mass effect, we had to, remove both his cerebellar hemispheres. So I thought after removing, he should be very grossly ataxic, but he came. Surgeons did a good job as always. I admire the surgeons like Manas. And then after a month, when the patient came for review, he had zero ataxia. So he had no cerebellum, but no ataxia also. And
wow.
Regarding this cerebrum hemispheres, we have two of them, left and right, and there are conditions where the entire hemisphere was damaged because of infarcts. And when you do a scan, you see only water there because of gliosis. There is no hemisphere left. And so I know many stroke patients who lose the entire hemisphere and they continue to function almost near normalcy. And especially if it happens at earlier age, if it's a child, say 6 years old or below 8, they have good plasticity in the brain and they function almost normally. Now over to Manas.
Yeah. So as Dr. Sudhir was telling, we need less than 10% of the brain to function normally, to become independent. That doesn't mean that 90% is useless brain. Probably for very high intellectual function, you need that 90%. But 10% is more than enough for what we are doing now to survive, to earn, to make others happy and be happy. So just because we have a brain tumor doesn't mean that we have lost many things. So when a brain tumor is there, like this is a 3D modeling of a patient, and this is the MRI, this is the tumor, and what we do a 3D, the red, its modeling is done, the red color is the brain tumor. So when a surgeon removes, we remove what is the non-functioning or the bad part of the brain. The normal brain is still there. So we remove the tumor which is not functioning. So if you remove, nothing happens to the patient. It's only if it involves some eloquent area, then only post-surgery they can have weakness, and that we can do some investigation before surgery to know that after surgery he has a chance of developing weakness or not. So these green color are all the fibers of the brain. It's the tracts. It's called corticospinal tract, the longitudinal fasciculus. So before surgery, we know whether these tracts are involved. Like in this picture, you can see the tracts are displaced. So the normal brain is displaced by the tumor. The tumor does not have any function. So even if you remove it, nothing will happen. So earlier, like 15, 20 years down ago, we never had MRIs where we could find out the tracts, or we could find out the blood vessels. Like the blue color is the blood vessels, which is the veins. We can the arteries, everything can be mapped. So before surgery, we know that which blood vessel, which vein, where are they, where are the tracts, and during surgery in the microscope, all this information and navigation, they are fed like a GPS. And like GPS, you type in the GPS, you can go to any part of the city, even though you are not from Hyderabad. Here also, the navigation will guide us which is the safer part of the brain to go and remove without causing deficits. So this for general public, if you have a brain tumor, don't get afraid that after the surgery you will become psychotic, you will become mad, you will lose memory. Brain tumor, after surgery, we just remove the part which is not functioning. So nothing is going to happen. Rather, you will be better after surgery because the pressure will come down on the pressure on the normal structures will come down. So your functions will improve. So you will be better after treatment rather than leaving it without any treatment. As people have a lot of hesitation of doing brain tumor surgery, one need not get afraid, but rather have it treated as early as possible, if diagnosed.
Thank you, sir.
I think that was a very fantastic insight from both, Sudhir and Manas sir, that, almost both the cerebellum have been removed and patient has come without any ataxia. That's such a positive insight if somebody has to go brain surgery. Me being a doctor, by the grace of God, never undergone under any knife till now. But yes, everybody as a normal human being are scared of surgeries, and that time to get such a positive response is a good thing. At this time, I'm very delighted if Dr. Raisa is here. Dr. Raisa is one of the very renowned clinician neurologist, my college mate and batchmate from CMC Vellore, and currently she's one of the leading neurologists, and she specializes in the stroke management. Dr. Raisa, we are talking about the brain tumors as the June 8th is arriving, and we'd be very happy to hear from you. How often do we get confused between brain tumor and a CVA in any given setup by an average clinician? Dr. Raisa.
Hi. Can you hear me?
Yes, very much.
Yes.
Yeah. Okay. Thank you, Ashish, for sending this. And I've just picked my mom up from the airport, got back and saw your message. So it was quite opportune. How often do we see it? I can't tell you the exact kind of incidence in a hyperacute stroke service, but the way they generally present to us is as an acute stroke call. I'm sure all the neurologists in India will be familiar with acute stroke call. So we get called to see a patient for thrombolysis. They go for a scan and we realize that they have a space-occupying lesion. And often these patients can present suddenly, like a stroke. That could be a variety of reasons. Either the tumor has bled sometimes, or it's caused seizures, and patients present with seizures. We know that seizures are a very common stroke mimic. And sometimes it's just due to the tumor-related vasogenic edema. So those are the reason kind of scenarios we see when we are on call for stroke. So is that something, does that answer your question?
Very much, Raisa. Rather, that brings to the point of me asking both Dr. Sudhir as well as Dr. Manas, how often have you had cases coming to you which kind of mimicked till the last moment that is a CVA, and then you found out that it was actually a brain tumor?
See, sometimes the brain tumors, Raisa, it's nice listening to you. And so basically, many times brain tumors, especially benign ones, they remain undiagnosed. And, so one patient I remember while at Vellore, so she was being treated for tension headaches. So she used to come with headaches to OPD and she used to be prescribed dothepin or, amitriptyline and sent home. Finally, one day after about 20 years of such treatment, she came to emergency in the middle of the night and with coning. So she was almost in deep coma. And then CT scan at that point revealed a large meningioma with mass effect, and so when a meningioma was allowed to grow, and then and then it could happen. So acute complications in a brain tumor which is undiagnosed can happen. Raisa already mentioned very nicely about the bleeds in the tumor. So some tumors are highly vascular, so they may not manifest initially. Patient may have mild headaches that they ignore, and then when it bleeds, then they come with focal deficits, hemiplegia. And then because initially scan is not done, or when you do a scan you see only blood, tumor may get hidden inside the blood. So unless you look at the scan carefully or do further scans like MRI, you may not pick up the underlying tumor. So that is another common thing that we see. So it can happen in benign tumors. In a cancerous tumor, generally because the rate of growth is so much that patients, sometimes it will mimic subacute conditions, like we have something called demyelination, not stroke as such, which can progress over a few weeks. And there, initially, if somebody has just done a CT scan and not MRI, then CT scan shows hypodensity, and that could mimic demyelinating illnesses. But if you go deeper into the scan and do a post-contrast scan, then it's easy to differentiate the two.
Okay, yeah. Thank you, sir. There's one question from the audience. Is cancer belt areas in India are myth or linked to particularly common cancers or particularly childhood tumors?
I think I'm not aware of any cancer belt. Dr. Manas?
No, not brain cancer. Means what probably is mentioning is there's some cancers are common in Kashmir because they use that hot water bag and all those. But brain cancers as such doesn't have any cancer belt areas and all those.
Okay, I think that was a great thought process to this. I think if I'm permitted, I would rather ask Garima to close down. I think we've kind of crossed more than an hour or so. We've had a really great interaction. I really thank for all the participants. That was a wonderful interaction. I definitely need to thank my colleague, Dr. Garima, who on the behalf of HearNC and Lions Club of Hyderabad Allied Doctors had come forward to do this meeting, because it's all about sharing information and saving lives. That's a whole dictum which I would want a tagline for us to carry on with. And not only that, we are having this discussion. The recorded version of this will be uploaded soon and will be shared with each one of you. A big thanks to none other than the other friends of ours, like from AED, we've had Dr. Ravi Mupudi, one of the top leading endocrinologists, a very hardcore academician whose whole team has helped us out. Definitely not to miss out Dr. Om Prakash and Dr. Prashant and other friends. Dr. Garima, over to you to say a word of thanks to everybody else from your side. Thank you.
Thank you, sir. Thank you, Dr. Ashish, for giving the opportunity and planning the webinar on such a short notice. And thanks to Dr. Sudhir and Dr. Manas for giving your time and accepting the invitation on such a short notice, and all the other audience who could join and create awareness. As our goal from Lions Club of Hyderabad Allied Doctors is to create more and more awareness. As Dr. Ashish always says, go to doctor when you don't need it, so that you don't never need them. So I'm very happy and privileged to be part of this webinar, and I would definitely like to get in touch with Dr. Sudhir and Dr. Manas for neurological patients to help them with their speech and swallow difficulties.
With this note, I would also want to add and request each one of you. I am Dr. Ashish Chauhan, available at 810-612-7475. Help us to know what is the need which we have it. We believe hardcore in Vasudhaiv Kutumbakam. The world is one, and we all need to stand together during this pandemic to be able to save lives. And information is something, though I am always reminded and always keen and interested in saying out the words of our beloved Bharat Ratna and Nobel Prize winner Mother Teresa. Whatever you and me do, that is a drop in the ocean, but this ocean will be empty without that drop. So do reach out to us and do tell us what else you want us to discuss more and more, so that we can, even if one life is saved because of this effort of ours, I'm very much believe that it was worthwhile taking all that pain. May God bless you all. A very good night to everybody. Shabba khair. Assalamu alaikum. Goodbye and good night.
Good night. Thank you, everyone.
Thanks.
Namaste.
Thank you.
Thanks, Manas sir. Really appreciate that.